Hi, this is Mike Bohlman at Powell Valley Healthcare, and we're here in the DEXA machine area. So if that humming noise, if you can hear that, that's the machine humming. But we wanted to do a second in our series of videos about screening. And so if you remember last fall, we had an article in the Powell Tribune about what a screening test is and why we do screening. And remember that screening is looking for disease or trying to figure out if someone has a disease before they ever have symptoms. And that's important if you can try to alter the course of the disease before it causes any problems. And so the first video we did was about colorectal cancer and screening for that. And the next one, this one, we thought we would do one about osteoporosis screening. So this machine is a DEXA scanner, and it measures your bone density. And so why do we need to worry about screening for osteoporosis? Well, the whole idea of screening is to try to figure out who might be at risk for a low impact trauma fracture from their bones being too, quote, thin. And so the reason that it's important is that about 250,000 people break their hip in the United States every year. And in the elderly, if they break their hip, only about half of those people that break their hip are able to go home and live independently again. Most of the time they have to move to a nursing home. And then one quarter of the people who have a hip fracture when they're elderly actually pass away. And so hip fractures cause a lot of morbidity or sickness and mortality, and it limits people's ability to live on their own. And so that's why osteoporosis is important. So when do you screen for osteoporosis? And so most people recommend screening with a history and physical to see if you have risk factors for osteoporosis, and then also recommend do DEXA scanning with this machine here to measure your bone density. And it's primarily recommended in postmenopausal women after age 65. You can sometimes do it before age 65 in a postmenopausal woman if they have other risk factors for osteoporosis, but in general, people wait till they're on Medicare, and then Medicare pays for these DEXA scans. Sometimes you'll screen men for osteoporosis, but that's just if you've seen an x-ray and for some other reason and you think their bones look like that they're thin, or the density of their bones looks low on a regular x-ray. Or if they've had some other risk factor for osteoporosis, which would be like a previous fracture from minimal trauma, or if they had prostate cancer and were on androgen deprivation therapy or long-term steroids or something like that. In women, the risk factors for osteoporosis is smoking is one of the things that increases your risk of osteoporosis. Also, a very small frame, so like women that weigh less than 127 pounds are at higher risk. Once their ovaries stop making estrogen and they go through menopause, that puts them at higher risk. And then excessive alcohol use, hyperparathyroidism, those are other things that increase your risk of osteoporosis. But the classic one is a little frail postmenopausal woman that smokes. Those are the people at highest risk. So basically, whenever you go to your doctor and you're getting to that age group around age 65, then they'll see if you have any risk factors for osteoporosis, and then they may recommend one of these DEXA scans. So what the DEXA scan does is it measures your bone density, and it measures it in your spine and in your hip. So you've heard of people getting compression fractures, which are where your vertebra collapse in your spine, and that can often be from osteoporosis. And so that's a risk. And then also the hip fractures that people get can often be from osteoporosis. And so what the DEXA scanner will do, it'll give the doctor a number score for how many standard deviations the person's bones differ from a healthy young person, and they use that and put it in this thing called a FRAX tool. It's a formula that determines your risk of developing a osteoporotic fracture. And if your risk is high enough, then the doctor may recommend putting you on medicine to help slow the loss of bone mass over time. The biphosphonates are those drugs like Fosamax you may have heard of. And then also, if you're determined to have osteopenia, even a loss of bone mass but not really osteoporosis, or if you have osteoporosis, then they'll probably recommend you taking vitamin D and calcium. Some people wonder if you should take vitamin D or calcium anyway. We used to recommend it for all postmenopausal women to prevent osteoporosis, but the data on that is pretty poor. And so now they're saying unless people have osteoporosis, there's not any real proven benefit of taking vitamin D and calcium. And then taking extra calcium might just give people kidney stones. And so if you end up having osteoporosis with the scanner, and your risk is considered high enough with that Frax tool, then you should have 800 international units of vitamin D a day, and then 1,200 milligrams of elemental calcium a day. But they recommend getting the calcium out of your diet more than with supplements. So anyway, your doctor can talk about all that. But the main thing to know is that there's a lot of morbidity and mortality from hip fractures and from compression fractures because they hurt. But people that get hip fractures when they're older lose their independence, and a quarter of them die. And so screening for osteoporosis is good, so they can put you on treatment to try to keep your bones strong enough to where you hopefully won't have a hip fracture and suffer those consequences of osteoporosis. So after age 65, for women, you should ask your doctor about getting a DEXA scan or what your risks are for osteoporosis. And in men, some people say after 70 start thinking about that, or if you have other risk factors for osteoporosis. So hopefully that helps with some osteoporosis screening questions.
Hey, Dr. Bohlman. Aside from vitamin D and calcium for helping with osteoporosis, is there anything else that a person can do?
Well, the best thing you can do is do weight-bearing exercise. And so what's that? Well, weight-bearing exercise just means you're fighting gravity, and so walking is one of the best things you can do. Your bones require gravity to lay down bone, and so fighting gravity by walking definitely would help. And then another thing to think of too is if as we age, one of the things you want to do is prevent falls, because there's debate on whether or not a hip fracture happens because of osteoporosis and you break your hip then you fall, or if you fell and you broke your hip. They don't really know which comes first, but the main thing to do is try to prevent the falls. So balance training and yoga are good things to do, because our balance gets worse as we age. And then also trying to get rid of throw rugs or any kind of tripping hazard at home, especially as people age, is really important. And making sure that their halls are lit, and like the path to the bathroom in the middle of the night is lit and without any rugs or tripping hazards. But weight-bearing exercise is one of the best things you can do. And stop smoking.
So what about the Lifeline screenings that come through town? Those guys do screenings for osteoporosis. Are those good?
Yeah. Well, so the Lifeline screening, the way I understand it, they do a calcaneal scan, so they do it on your heel, and all the rheumatologists don't like that. What's important is the bone density in your hip, and so there's not really good standards for the heel scans, and so most of us, if someone comes in with Lifeline screening and they had a low bone density in their heel bone density, we'll go ahead and order a DEXA scan so we do a real one and see what the hip and the spine density is like.
So if a person gets a DEXA scan and it comes out normal, do they have to repeat that like every year or two?
Yeah, that's a good question. So they think that it takes maybe 16 or 17 years to go from normal to osteoporosis, and so it takes a long time. So if you get a negative DEXA scan, you probably don't have to repeat it for several years. There's debate on how long, but maybe at least 5 years, 5 to 10. If you're osteopenic, meaning slight loss of bone density, or osteoporotic, then generally most people check them every 2 years after they do some sort of intervention and see if they're slowing the loss of the bone density. Another thing to think about is what they recommend doing all your DEXA scans on the same machine if you can, because there's differences between different machines, and you're basically comparing one DEXA scan to a future one. And so they say to get your DEXA scans done on the same machine if it's at all possible. Tune in next time for our next video on screening, and we'll do something else.